Welcome to the sixth and final section of your AHIMA CCA exam preparation course, where we will thoroughly explore confidentiality, privacy, and data security. In this lesson, you will learn the critical laws and ethical standards that protect sensitive patient information from unauthorized access and cyber threats. This topic is incredibly important because as a medical coder, you will have daily access to highly confidential medical records. And protecting the data is both a legal requirement and a moral obligation. I am excited to guide you through these final essential concepts, giving you the complete knowledge base you need to conquer this exam. Prepare yourself for an engaging look into the rules that keep modern healthcare secure, as this is the final step on your journey to certification. The absolute cornerstone of healthcare privacy in the United States is the Health Insurance Portability and Accountability Act, universally known as HIPAA, enacted in 1996. HIPAA established the very first national standards to protect individuals' medical records and other personal health information. Before HIPAA, there were no uniform federal laws preventing your doctor or hospital from sharing your private medical history with anyone they wanted. For your exam, you must understand that HIPAA applies to covered entities, which include healthcare providers, health plans, and healthcare clearinghouses that transmit information electronically. Within HIPAA, there are two major rules you must clearly distinguish, which are the privacy rule and the security rule. The HIPAA privacy rule focuses on protecting the privacy of individually identifiable health information, which is officially called Protected Health Information, or PHI. The privacy rule sets strict limits and conditions on exactly how and when a hospital can use or disclose a patient's PHI without obtaining the patient's explicit authorization. It also gives patients powerful rights over their own health information, including the right to examine their records and request corrections. Protected health information is a concept you must thoroughly understand for the exam. PHI includes any information about health status, provision of healthcare, or payment for healthcare that can be linked to a specific, identifiable individual. This includes obvious things like a patient's name, social security number, and medical diagnosis. But it also includes photographs, vehicle license plates, and even email addresses if they are tied to a medical file. If a piece of information can be used to figure out who the patient is, it is legally considered PHI and must be protected. A central concept of the HIPAA privacy rule is the minimum necessary standard. The minimum necessary standard states that when a healthcare worker accesses, uses, or shares PHI, they must only use the absolute minimum amount of information necessary to accomplish their specific job task. For example, a hospital billing clerk needs to see a patient's demographic and insurance information, but they do not need to read the detailed psychiatric notes from the patient's therapy session. The exam frequently tests your ability to apply the minimum necessary rule to various hospital scenarios. While the privacy rule protects all forms of PHI, including paper and spoken words, the HIPAA security rule focuses entirely on electronic protected health information, known as EPHI. The security rule requires covered entities to implement specific safeguards to ensure the confidentiality, integrity, and availability of all electronic health data they create, receive, maintain, or transmit. As hospitals increasingly rely on electronic health records, the security rule provides the technical blueprint for defending against hackers, malware, and digital data breaches. To comply with the security rule, hospitals must implement 3 specific types of safeguards. Starting with administrative safeguards. Administrative safeguards are the documented, written policies and procedures that manage the selection, development, and implementation of security measures within the facility. This includes conducting mandatory security training for all new employees, appointing a dedicated security officer, and developing a formal disaster recovery plan. Administrative safeguards act as the management framework that guides how the hospital approaches data security on a daily basis. Physical safeguards are the tangible, real-world security measures that protect a covered entity's electronic information systems and physical buildings from natural and environmental hazards, as well as unauthorized intrusion. These safeguards include locking the doors to the server room, using security cameras, securing laptops with cable locks, and requiring employees to wear visible identification badges at all times. A common physical safeguard tested on the exam is positioning computer monitors so they face away from public hallways, preventing unauthorized visitors from easily reading patient data. Technical safeguards refer to the actual technology and computer software used to protect EPHI and control access to it. The most common technical safeguard is requiring employees to use unique, complex passcodes and passwords to log into the electronic health record system. Another critical technical safeguard is automatic logoff, which forces the computer screen to lock itself if the user is inactive for a certain number of minutes. You must understand that sharing your password with a coworker, even just to help him out, is a massive violation of these technical safeguards. An advanced technical safeguard heavily utilized in healthcare is encryption. Encryption is a mathematical process that scrambles readable electronic data into an unreadable, secret format before it is transmitted across a network or stored on a device. The only way to unscramble and read the data is by possessing a specific digital decryption key. If a hospital laptop containing thousands of encrypted patient records is stolen from a doctor's car, the hospital does not have to report it as a data breach because the thieves cannot possibly read the encrypted files. When a hospital needs to hire an outside company to help them perform a job that involves accessing FI, they must use a business associate agreement. A business associate is a person or organization, like a third-party medical billing company or a document shredding service, that performs certain functions on behalf of the hospital. The business associate agreement is a legally binding contract that forces the outside company to follow the exact same strict HIPAA privacy and security rules as the hospital itself. Without this signed contract, the hospital is strictly forbidden from sharing any patient data with the vendor. Despite all these safeguards, data breaches still occur. Which brings us to the HIPAA breach notification rule. A breach is defined as an impermissible use or disclosure under the privacy rule that compromises the security or privacy of the protected health information. If a breach occurs, the hospital is legally required to notify the affected patients, the federal government, and sometimes even the local news media. depending on how many patients were impacted. The exam expects you to know that the timeline for reporting a massive breach is incredibly strict. As a medical coder, you must be constantly vigilant in recognizing and reporting any privacy issues or potential security violations you observe in the workplace. If you notice a coworker accessing the electronic health record of a famous celebrity out of personal curiosity, you are ethically and legally obligated to report that incident to your compliance officer immediately. Failing to report known privacy violations makes you complicit in the act and can result in severe disciplinary action, including the loss of your own AHIMA coding credential. You must also be aware of the modern regulatory concept known as information blocking. Information blocking is a practice by a healthcare provider, IT developer, or health information exchange that is likely to interfere with, prevent, or materially discourage the access, exchange, or use of electronic health information. Essentially, the government wants to ensure that patients can easily and freely access their own digital records without hospitals placing unreasonable delays or technical barriers in their way. You will likely see exam questions regarding the federal push to eliminate information blocking. While we covered the release of information process briefly in the first section, it is vital to revisit it under the lens of privacy. When releasing patient-specific data to authorized individuals, you must ensure the patient has signed a valid, highly detailed authorization form that specifies exactly what data can be sent and to whom. There are strict exceptions where authorization is not required, such as sharing data for treatment purposes, public health emergencies, or mandatory law enforcement reporting. Knowing when you can and cannot release data without patient permission is a massive part of the exam. Transferring electronic documents safely is another daily concern for health information professionals. You must never send patient information through unsecured, standard email platforms or basic text messages, as these can be easily intercepted by hackers. Instead, hospitals must use specialized, secure messaging applications and encrypted email portals that require the receiving party to log in before they can view the message. Ensuring electronic documents are only transferred through approved, secure sites is a non-negotiable standard in modern healthcare. Maintaining a secure work environment extends beyond just computer passwords, because it requires a culture of constant awareness. This means never discussing patient details in public areas like hospital cafeterias or crowded elevators, where visitors could easily overhear the conversation. It also means actively educating healthcare staff and reminding them not to post anything about their workday on social media, even if they do not use the patient's name. A secure work environment relies entirely on the daily, disciplined habits of the people working within it. We must also revisit the retention and destruction of confidential records to emphasize the security aspect. Retaining confidential records appropriately means storing paper charts in locked, fireproof cabinets and ensuring electronic servers have massive, redundant backups in case of a natural disaster. The goal is to ensure the data is perfectly preserved and securely accessible for the entire duration of its legally required lifespan. Your exam will test your understanding of how physical and electronic retention methods differ in their security approaches. Finally, destroying confidential records appropriately is the absolute last step in protecting patient privacy. when a record reaches the end of its legal retention period. It cannot simply be thrown in the regular garbage. Paper records must be completely destroyed using cross-cut shredders or professional incinerators, while electronic hard drives must be physically pulverized or wiped using military-grade software to ensure the data can never be recovered. Proper destruction guarantees that the patient's sensitive information is permanently erased and protected forever. Congratulate yourself on successfully completing this final section and finishing the entire content portion of this AHIMA CCA exam preparation course. I highly encourage you to complete the attached practice test for this section, as testing your knowledge is the absolute best way to guarantee high retention and actual exam readiness. This specific practice test is included directly with this lesson to ensure you get the active learning experience you deserve. You have worked incredibly hard to master this complex material, and by utilizing these practice questions, you are taking a fantastic, positive step toward passing your certification exam and launching a highly successful medical coding career.